Good afternoon there, folks. So my name is Danny McCann. I'm down here with Industry Training Services in Portadown, and we'd just like to first of all thank Ernie Spence for giving us the opportunity today to bring to your attention the CPR and defibrillation awareness induction. This is following recent interest after the collapse of Mr. Eriksson at the European Football Championships earlier on this year. So I'm now going to give you a live demonstration of cardiopulmonary resuscitation, which is just focused on the compression side, because that's what the UK Resource Council are saying at the moment. Okay, right? Important to note, your knees need to be in touch in the dole. Yeah, you need to be sitting up on your hip, not backwards like that. Up nice and forward with a nice straight posture. The heel of one hand will go onto the centre of the chest, onto the sternum. The other hand goes on top. And all I'm going to do now is I'm going to keep my hands in that position, lock my elbows out, and I'm going to rock backwards and forwards on my hips, just like a crocodile's jaw, opening and closing, to ensure I get the distribution of even weight across them. What we're using here is the technology behind us, which will show you the height and the depth of each compression. The importance of this, folks, is that when you start, the heart here is effectively stopped working as a pump, and all you're now doing is manually taking over from that pump. So every time you push down on the patient's chest, you're squeezing the heart, which moves all the blood out of the chambers into the body. Every time you come up, you're sucking blood back in. So it's effectively like a sponge. Yeah, you're pushing out and you're sucking back in again. If you don't go down far enough and come up high enough and stick to the right rhythm whilst you're doing CPR, you will not fill enough blood into the heart and the cardiac arrest will continue. So it's important to make sure you get yourself in the right position so you get a good even distribution of your weight on top of the person's chest, so you can effectively pump the heart as if it was manually doing it itself. What this technology does is it shows you the effectiveness of your compression, and as long as you're above 70%, you're giving the person the best chance you can. So I'm now just going to give you a demonstration of the combination of the cardiac or the compression plus the breathing, the pulmonary side of resuscitation. This is where you're putting air into people's lungs. So when an adult that's non-breathing or is not breathing correctly, yeah, and they have that cardiac arrest, a wheeze about them, you're going to start off with 30 chest compressions followed by 2 rescue breaths, like so. You'll notice now I've got a mask on front of the doll's face, and the lungs will be changed at the end of this session. So, as previously taught, hands are on the centre of the chest and count to 30 when you're doing your compressions. Pinch the person's nose, extend their head and neck back, seal your lips around their lips and blow in twice like so. And then again, back to 30 compressions. Hi folks, so just moving on then, just from manual CPR, we're now going to introduce the use of a defibrillator. Defibrillators are electrical devices, so they're looking for monitoring the electrical position of the heart. So CPR has to be started first, because if there's no blood moving through the heart, the electrics won't work. However, when defibrillators turn up on the scene, it doesn't matter what phase or what stage you're at in CPR, you stop immediately and attach the machine to them. Some will have an on switch or a pull lever. It makes no difference really at the end of the day, folks. They're all doing the same thing, irrespective of shape, size, model or colour, and listen to it.
Begin by removing all clothing from the patient's chest. Cut clothing if needed. So,
items that require cutting, t-shirts, you need to remove lots of clothing here, and you need to get the person down to skin. So, especially when you're dealing with females, bras need to come off as well.
Cover and take out white adhesive pads.
The machine's telling me to remove the protective cover and take out the white adhesive pads, the ones with the wires attached to them.
Look carefully at the pictures on the white adhesive pads. Peel one pad.
There's 2 different positions for the pads to go in. It doesn't really matter what pad goes down first. It just matters you put the right pad in the right place. That's why the machine's telling you, look carefully at the pictures on the pads. Make sure the defibrillator is on the same side as you. Take the first pad off and place it down.
Place pad.
Remove the liner from the second pad, and as soon as you put the pad on, the machine will start to analyse. And it's important at this point you're not touching the patient.
When the first pad is in place, no one should touch the patient.
Warn people to stand back. It's now analysing.
No one should touch the patient. Analysing. Shock advised. Stay clear of patient.
This machine is a manual machine, so it means you have to press the orange button yourself. But make sure nobody is touching the patient before you hit the button, so shout stand clear and then press the button.
Shock delivered.
And the patient will jolt a little bit.
Be sure the ambulance service has been called.
But you've just stopped their heart.
Start CPR. For help with CPR,
more CPR has to begin, and the machine is now telling you to conduct CPR again. And if you need help with that and you're not sure what you're doing, press the flashing button.
Place the heel of one hand in the center of the chest between the nipples. Place your other hand on top of the first. Push the chest down firmly 5 centimeters.
The machine will give you a rhythm to stick to, and it even counts to 30. This is the benefit with these machines. When people talk about plug and play, it's an activated voice, nice in a calm manner, and it tells you what to do. And you'll put through approximately 5 rounds of CPR, and then the machine will reanalyse again.
Chin. Continue with compressions.
We're now into the 5th round of compressions. Once I've done 30 compressions in this round, the machine will tell me to stop, and it will reanalyse the patient. This can take 15 to 20 seconds, and depending on what the machine finds will depend on what it says.
Stop CPR.
CPR stopped.
No one should touch the patient.
No one's to touch the patient. The machine is analysing.
No one should touch the patient. Analysing. Shock not advised. It is safe to touch the patient. If needed, start CPR. For help with CPR,
the machine has just said to you, shock's not advised. If needed, start CPR. That's because the machine is seeing one or two things. It's either seeing a normal heart rhythm, electrical tracing, or it's seeing flatline, which is dead. But the machine doesn't know what. So when it's telling you it's safe to touch the patient, start CPR if needed. Do a 10-second breathing check on the patient. If at the end of that 10 seconds the patient's breathing, we're going to put them into the recovery position. If they're not breathing, we're back to CPR again. So depending on what you find will depend on what your next course of action is, folks. That's the combination of CPR and defibrillation together.